Everything we know from science and from practice tells us that making laws to tell people how to have sex isn't really very effective in influencing how they have sex. It certainly won't stop the HIV epidemic or even slow it down in any meaningful way.
Earlier this year, the HIV Justice Network flew to Toronto to take part in an international meeting on HIV prevention and criminal law. This 3-day workshop was a unique opportunity to meet all of the social scientists who've undertaken research on the public health impact of HIV criminalisation.
I think we looked at a deeper level of the effects of the law on the HIV epidemic than I have seen happen until now.
Criminalization of HIV non-disclosure has placed disclosure at the center of people's concerns around HIV prevention. Disclosure is not an effective HIV prevention mechanism.
And I think one of the things that we're hearing increasingly is from public health practitioners who are starting to say that from their perspective, as people who are working to protect public health, the unwarranted overextension of the criminal law is in fact complicating their practice as public health professionals.
And in particular, I looked at post-test counseling. One of the main findings I found is that nurses have to be very careful to manage that relationship, and that oftentimes they're finding that clients shut down.
It was clear that many health officials in Michigan were invested in potentially criminally prosecuting their clients. And I can understand why people living in some of these communities would think twice before talking to health officials about their lives openly and honestly.
We shouldn't have legal reasons for people not to get tested. We shouldn't have a legal reason for people not to access care. And half of our respondents said that it was reasonable to avoid HIV testing because of HIV criminalization.
How do you provide care when people won't access it? And so you can't provide services to people who aren't in clinics. And if they're not in clinics, then what are the health professionals supposed to do? Absolutely nothing. Like, the laws have effectively rendered your HIV prevention health professionals useless.